So I'm going to start with the question here. Could you fill us in on how you started your career and what led you to pursue becoming a clinical psychologist?
Yes, so kind of rewind back to the days of sixth. So in the UK, you complete your GCSEs when you're 16, and then you go into a sixth form or a college for 2 years until you're 18. And in that time, I did a psychology A level because it sounded interesting. Had no idea really what it was about, and really enjoyed it. And so thought, okay, yeah, let's do that at university. Not really knowing what I wanted to do, or I was just following my interests. And then throughout my degree, again, modules that I chose and things like that, I just followed my interests. Although we were completely put off doing clinical psychology because they were telling us, it's really difficult to get into, and so I didn't really think about it until I got good grades, and then thought, oh, maybe it was possible, maybe I could do it, and just found different jobs in sort of, first of all, research in addictions research, and then in sort of primary care mental health, getting kind of experience, and again just following things that sounded really interesting to me, and then ended up managed to get onto a clinical training course not far from home at Southampton, and then from there I worked in the NHS for a few years, and then once I had children, started working from home in a small private practice. So yeah, just all the way, just following my interest really. No kind of epiphany moment of thinking, yes, this is what I want to do and this is my passion. I
Hmm.
just found psychology fascinating. I always read about psychology. And actually, I'm part of a book club where we're supposed to read fiction, and I never complete the books because the books I like to read are actually kind of psychology, really, boring to other people, but kind of non-fiction stuff I prefer. So yeah, I just all the way followed what fascinated me.